So Shinya's obviously come to Stanthorpe from Japan and brought his experiences to us, and has been able to learn about a lot of the systems of support that we have in Stanthorpe, as well as learn, I suppose, the way that we integrate as a team within Stanthorpe, and how the system, is able to be managed to address the needs of the community. So. One of the key things that we started off with, and I sat down with Shinya, was to look at the systems and supporting systems that we have. We've actually looked at some of the things like our clinical prioritisation criteria, our clinical guidelines, and other standards of care that we actually have within the facilities, so that he had an understanding of where we actually get some of our quality control processes from. And from there, Shinya's been able to engage within the everyday running of the hospital, from maternity, emergency, acute ward, into theatre, and outpatients department as well. So he's had experience right across the whole spectrum of the hospital, and been involved with all of the clinicians that work at Stanthorpe. So Stanthorpe Hospital, as you know, has been one of the leads within regards to rural generalist training over a long period of time. We were lucky enough to have Dr Dan Manahan, who was the original medical advisor for the Rural Generalist Program here, and a number of our colleagues since have had varying roles in the Rural Generalist Program over time. The model that we have is a Rural Generalist model. It's set up as an integrated learning model as well, right from medical school with our Griffith University Longlook program and other relationships with James Cook and the University of Queensland, right through the previous experience with the PGPP program, and of course we've continued that with our intern program, and now we're rolling that through with our Registrar PHO program, which goes into pre-vocational and fellowship training as well. So I think that Shinya's been able to have a good appreciation of that, and look at how we use that integrated learning model right across the spectrum.
My wife and my kids are enjoying every day. So my son, 6-year-old, goes to this town school, kindergarten school. But he couldn't speak English well, but he enjoyed some gesture and humble with his friends. I want to say Dr. Dan and Dr. Drip, I'm appreciate to get the opportunity, great opportunity to come here. So thanks for them.